Right. Good morning, good afternoon, and good evening, everyone. Thank you so much for joining us on this exciting episode of Changepreneurs. Changepreneurs is a podcast that a bunch of us coaches have started, and the mission that we have is to make change through the world, one person at a time. Today, we are honored to have a very distinguished guest on our podcast and a very unique guest, and I'll get to why in a bit. But before that, I would like my co-host Bianca to give a small introduction and post that, which I would follow and then introduce our guest. Bianca, over to you.
Thanks so much, Pushkar. Hi, everyone. I'm Bianca Page Smith, and I am coming to you from North Carolina in the USA. It's morning time for me as we're recording this, and I am a stress management coach. That's my main profession at the moment. But I bring my background in dance, neuroscience, and yoga to my practice with my clients. And I am very, very excited to be here with today's guest and learn a little bit more about her unique philosophy, which I think also has a holistic approach, which is very exciting. So I'm really happy to be here. Thank you for having me and just looking forward to an amazing conversation.
All right. Thank you, Bianca. And I'm sure all of our listeners are also looking forward to hear everything that we have to say today. So, quick introduction before I introduce our guest. My name is Pushkar Vaidya, and I am a certified career coach right now. And I have do this after around 26 years working in the corporate industry. So, not much to say there, but I am now going to head over to introducing our guest. So, Dr. Nondumiso Stevenson is a certified physician, leadership development, and executive coach with over 20 years of experience in healthcare. She is a very passionate advocate for the Ubuntu-centered leadership. She draws on the African philosophy of interconnectedness to help physicians align their personal values with their professional aspirations. She is deeply committed to guiding healthcare professionals towards purposeful, authentic leadership and fulfilling careers. Reason why I mentioned unique is because she holds the distinct honor of being the world's first medical trained and certified doctor in Ubuntu coaching. So that makes for a very, very interesting conversation for us today. And Nondumiso, thank you so much for joining us. And if there is anything that I missed in my introduction of yours, please fill us in before we get started.
Oh, no, I think that was more than adequate. And thank you so much for inviting me to be part of this platform. And I'm excited to be here. I'm sure we're going to have a very robust and interesting conversation, as usual.
Absolutely, absolutely. All right, so I am going to get right to it to my first question. Um, Something that I have wondered about in every conversation that we did, but probably I didn't ask you about it. What inspired your transition from being a medical doctor to an ICF coach?
Right. So it's an interesting question in the sense that I don't really consider myself as having transitioned per se. I think most of us in I'll call it the caring professions, are already coaches. You know, when you think about my training, of course, I'm a medical doctor, as you mentioned. We don't often think about the interactions that we have with our patients or even with our colleagues, or if you've managed a team as a leader, you don't really consider yourself
Okay.
a coach. So for me, it's
Uh
not
huh.
necessarily a hard line in terms of coaching. I still feel like I'm doing both, but my journey towards coaching really started about 2 years ago, where I started interacting a lot more with colleagues who I found were struggling. You know, we're just struggling with all the changes. If you know anything or read anything about healthcare, you'll know that it's a very dynamic and very pressured environment. So over time, you know, as I spoke to colleagues, I realized that there were so many challenges that they were going through, and through those
Mm-hmm.
conversations, that really planted a seed for me to start thinking about coaching as as an offer, not just sort of an informal conversation, but really to look at myself and develop as a coach so that I can support my colleagues through all the different challenges that they're faced with, particularly as leaders.
All right, interesting. And I think I find true purpose in what you've said. And it's not just that, you wanted to be a coach, hence you became a coach, but I find true value and purpose behind the reason why you decided to embark on this journey. Very interesting. Thank you for sharing that. Okay, you mentioned about the unique challenges that the doctors, you notice that the doctors face during their journeys. Could you elaborate a little bit about that? Because what us normal laymen would know that doctors have very high stressful jobs, and the chances of burnout are very high, knowing a few doctors myself. So what are your views on that?
No, definitely. It's really a plethora of challenges that doctors face, and thank you for recognizing the stress that comes with the job, because often as doctors we just don't really spend too much time thinking about that. It's sort of for us par for the course. It's, this is what we've accepted, sort of been trained on, and we often lose sight of the fact that our jobs are actually very, very stressful. Working with people in different environments, sick people, people who need
Hmm.
your help, who are depending on you and your advice. It comes with a lot of psychological stress. Of course, there's also the physical stress, because in
Okay.
most countries and environments, doctors will work very, very long hours as well. So absolutely, burnout is one of the major issues that's become very prevalent, especially during COVID. I think we really saw
Mm.
made significant increases of stress and burnout that doctors experienced. But there are other challenges, some of them that are peculiar to medicine, and similar professions, and some that I think are universal. Maybe my journey is a good way to demonstrate some of those challenges. But one of the areas that are often coach around is the transition from clinical medicine to non-clinical medicine.
Okay.
So our training is really oriented around the patient. Medical school, the focus is having a patient in front of you. That's most of how the training is designed. But of course, there are other opportunities in the world where doctors can apply their healthcare or medical knowledge in corporate, in non-governmental organizations, but where they're not necessarily working with patients or dealing with
Hmm.
patients or patient care directly. So, that for me was a very difficult transition, uh, because I had to, it was a lot of trial and error for me to get comfortable with not being in front of the patient, and just to sort of
Okay.
adjust my mindset. Because a lot of our, when you talked about purpose, a lot of our immediate gratification and knowing that you're on purpose comes with that patient interaction, that thank you doctor, you saved my life, that makes you feel good. So if you're now in an air conditioned office for 8 hours a day
Hmm.
and this is your job, you don't get that
Yeah.
feedback. So you have to find ways of getting that same satisfaction, aligning with your purpose without necessarily being in front of the patient, but contributing to that healthcare. So that's kind of the first area that I've found many doctors, experience challenges having to redefine the doctor identity. Who am I as a doctor if I'm not in front of a patient? Is sort of the question that you ask yourself. Even your family will ask you.
Hmm.
If you've got doctors in your family, you go to them for medical advice, and maybe they prescribe, or if they dispense, they treat you that way. older doctors, they used to have their little black bag with their medications. So
Yep,
you
I
have to
remember.
really, yes. So you have to really redefine who you are as a doctor. And nobody is necessarily available for you at that time. So that for me is a part of what I find helpful in coaching doctors that are transitioning from a
Hmm.
clinical scenario to a non-clinical scenario. The second area is around leadership. Leadership in our context, in our training, is not, we don't really have didactic training on leadership. Although obviously I graduated many years ago, almost 25 years ago.
Hmm.
But my understanding is that still it's not as much as one would really like, to have. And leadership is complex. Even I think for people who have been trained on leadership,
Hmm.
it's not you don't just go and get your MBA or whatever course and then
Yeah.
that's it, you're a leader. It's very complex. So given that we don't also have a lot of training, and leadership in the clinical context is quite different. It's not, we trained around, when you're a senior doctor, you do the doctor's orders, so you
Hmm.
just write what needs to be done, and then everybody kind of knows their place, and they know what to do. When you move into a different environment, you have to adjust not only to the non-clinical role, but also working in cross-functional teams, for example, and managing people who are not in the medical field or in the healthcare field. So if you are, say, in a hospital environment, you might be working with physiotherapists, nutritionists, or
Yep.
dietitians, nurses, of course. So it's a very familiar and comfortable environment. But when you experience leadership that is not in the healthcare field, now all of a sudden, or even within the healthcare, depending on your seniority, let's say you become the dean or the vice chancellor of a
Hmm.
medical school. Now you're going to have to be working with people who are legally trained, or financially trained. Supply chain management becomes part of it,
Hmm.
PR, all of these very different roles that in our training we didn't really interact with much. And so your understanding of the healthcare ecosystem gets expanded beyond what you've been taught.
Hmm.
So those are some of the challenges. So I would say, probably from my experience, those are the three areas that anyway, I like coaching around, the stress and burnout, the
Yeah.
career transition, and then the leadership.
Wonderful. Something that really stood out for me was thank you, doctor. You saved my life. And while I take that in and everything else that you said, I'm going to hand it over to Bianca to take this forward.
Mhm.
Thank you. Nondumiso, thank you so much for sharing all of this. What you just spoke about made me think about something that I wanted to ask you. I was listening to one of your recent interviews where you spoke about how medical school is hard on young doctors, and sometimes they come out of it with a feeling of imposter syndrome. So I was really curious to hear about what are those. You spoke a little bit about some of the struggles, but I'm curious about what are those kind of struggles that um, physicians navigate when they are talking about more of the psychological and emotional aspects of the identity and the role that they take on as doctors. I would really love to hear more about that, and also how you support people in your coaching practice if you encounter that.
Yeah, a great question. And this weekend, actually, I did a talk on that to some healthcare professionals around imposter syndrome. So it's nice and fresh in in my mind. And thank you for talking or referring to it as a psychological, basis, because, or having a psychological basis. I think it's been studied very well, and I also appreciate the fact that You mentioned that you respect neuroscience, because I think the more I read about imposter syndrome, the more I understand the neuroscience of it. I think many people have obviously studied it, but what I think is common with men, people who experience subjectively or even objectively imposter syndrome with doctors is that they are high achievers, right? So the typical doctor is probably somebody that made a decision at some point that they want to become a doctor, and understanding the criteria to be accepted into a medical school, they had to perform very well academically. This is my experience around the world. So typically, the medical student is somebody that is a high achiever, somebody that is very ambitious, somebody that understands also the culture of medicine, which is around perfectionism. So there's also that sort of interplay with perfectionism. And so what I've observed is that when it comes to imposter syndrome, doctors tend to have a lot of thoughts. I think one of the coaches called them saboteurs, right? The high achiever saboteur, where you're always striving for excellence. I think it is important to emphasize that we do need excellence in healthcare. That is a non-given for me. It's not an excuse, because we are dealing with people's lives. So you have to really do the very, very best that you can when it comes to managing your patients and being excellent at the science and the medicine of it all. Where, of course, it's problematic is where even your very, very best and the best that you could have done is still not good enough, and you have this voice that is telling you that, amongst these group of doctors who are all high achievers, you are going to be exposed as the weakest or the least competent, So that sometimes I think does come out in conversations with doctors because of, I think, the personality of doctors, the high achiever, the culture of medicine, where we really have to do your very best. So it's definitely, I won't say common. I don't have the stats, but I know certainly in one of the studies that I saw recently, about 25% is estimated to experience some symptoms of imposter syndrome. But we know also that it's a silent condition. Very few people will talk about it and say, oh, I have imposter syndrome. I feel like I'm going to be exposed as a fraud. So it's a struggle, and as I mentioned, I've worked with many doctors that in very senior positions, people who are really at the top of their game, but who will be sitting and struggling with feelings of self-doubt, that they don't openly express or feel comfortable to openly express. So thank you for that question. It's quite an important one that I think doctors certainly can benefit from coaching, at least at a minimum, to expose, how they consider themselves, so that they strive for excellence, strive for excellence in healthcare and patient care, but without whipping themselves, and being able to build the self-trust and minimize that voice that's saying you're not good enough, There's always in their ear.
Yeah. Thank you so much for sharing that. I think it's such an important aspect of the holistic approach to what it means to play a certain role, right? Especially because when we talk about stress and burnout, most people think of the physical aspect of it, but there's also the internal aspect where you feel the stress and the pressure from within. And I definitely would see that imposter syndrome and self-doubt to be a huge source of personal and internal stress for people. So I'm really loving that you're highlighting this and double clicking on it, because I think that there's a lot of people, not just doctors, but people listening to this who can benefit from recognizing that, yes, okay, I want to be excellent. And also, there are some things that I'm experiencing in my internal world that are really weighing on me and may even be impacting my ability to allow my unique excellence to come through. So I really appreciate this, this aspect of your multi-passionate approach to what you do. I would love to ask a follow-up. Pushkar, are you okay with that
Yes.
if I
Yeah,
just
yeah,
follow up on
absolutely,
this?
Bianca, go ahead.
Okay, so what I'm curious about is just, I know your background, you've worked in many different places in the world and completely different cultural areas. And I'm very curious about if you find that any of the struggles you've already mentioned or the imposter syndrome shows up more or less in a certain part of the world that you've worked in.
Absolutely not. And I had, and I had that same curiosity. It's an excellent question. So I've coached medical clients from South Africa, Zambia, Rwanda, Kenya, Tanzania, and United States. Absolutely the same, mindset issues. And I think it really speaks to, I know we're going to talk a little bit more about Ubuntu, but I think the human experience is very, very similar across culture, especially when it comes to the caring professions, So for me, I had kept myself quite open to maybe understanding where the nuances and the differences are. But where I am now with the clients that I've coached and the variety of clients that I've coached, this is my early conclusion that actually, when it comes to issues like imposter syndrome, we are generally experiencing it in exactly the same way. The language that we use is exactly the same. What might be different, perhaps, would be then the support structures and the external parts of it, but the internal workings are exactly the same. That's been my experience.
That is just amazing. I mean, not amazing that so many people are experiencing imposter syndrome, but amazing to hear that there is just something about us all being on this shared human experience, and those who are called down a similar path of being in, as you say, the caring professions, have a similar way of working through it internally. I was not expecting you to say that, but as you explain it, I'm just thinking that makes so much sense, because we are all interconnected, as you say, and we will definitely get more into the Ubuntu philosophy at some point during this time. But I think that's a beautiful example of interconnectedness, and I'm so grateful that you shared that with us today.
Yeah, I mean, I was also, I don't know whether to call it pleasantly surprised or only surprised to say that your experiences, whether it's South Africa or the US, you see similar problems or similar themes across everybody you speak to. So it's quite a revelation for me personally. So we've spoken about stress, we've spoken about the imposter syndrome. So I'm going to bring in a little bit of coaching here now. So how, in your current practice and in everything that you do right now, how do you guide doctors, or rather, let me say, how do you coach doctors to balance their demanding careers, the stress, the imposter syndrome, the everything that we've spoken about, with their personal well-being?
You know, the the it's a good question, and I think I try to hinge everything around the Ubuntu framework, because it provides the answers to a lot of the questions that we might have. And it's applicable to all the areas of our work that actually may be a source of stress. And why I believe very strongly that it's applicable in all, certainly from my exposure. Maybe down the line I'll say most, but certainly in all, is that it's very much aligned to a universal law of oneness. So anything for me that is aligned to the universal laws, is there's a truth in it, that and that means that it can answer so many questions. It can be a resource, and it can be a solution for many questions. So, but to get back to your question about how I coach around it, I think that's sort of the first aspect that I always agree with with my clients is looking at issues through that prism of Ubuntu. I think if it's okay with you, it might be a good time to just kind of unpack what that means and then what that looks like.
Absolutely.
Yes. So I will share with you that Ubuntu is it's an Nguni language. It's an African philosophy. I am Nguni speaking. I'm in the Nguni group, which is a group of tribes, African tribes, and within that there are different languages, Nguni languages, of course, and one of them is isiZulu. I love the way that we greet in isiZulu. We say sawubona, sawubona, and the direct translation of that is I see you. And
I see
that
you.
for me underpin I see you. I
Okay.
see you. Yep. And that underpins the Ubuntu philosophy for me, and explains very well. It's recognition of the humanity in another person. And so when you look at the world in that way, that, recognizing that Pushka and Bianca are human and they see me as human, that is the one level at which we can connect. Ubuntu has been broadly translated as saying, I am because you are. So when I affirm you as a human being, I am in essence affirming myself as a human being. And so you cannot be, on your own, right? To practice Ubuntu means that there is a connectedness with another human being. It's about affirming each other as human beings and all the amazing qualities that we have as human beings in this world that we are in. And so by nurturing you, I'm nurturing myself. By coaching you, I'm coaching myself, which I know you already know that that's what we do. The
Yes.
peer coaching that we do, is really in the spirit of Ubuntu. As you help me to refine my coaching skills, you are in the process also growing. So in the healthcare space, there are so many applications of this, and this is an area that I'm also trying to deepen. I've got two mentors, one who's focused on Ubuntu in leadership and one who's focused on Ubuntu in coaching. So they're really helping me and supporting me. I'm very early in my journey of making sure that we elevate and reconnect, actually, because I think it's something that is innate, right? We reconnect with Ubuntu in our clinical practice. Now, I have, seen how it works, for example, with patient care, where one of the principles of Ubuntu is co-creation. And you'll find that, I don't know your experience with doctors, maybe I get treated differently because I'm also a doctor, but you may find that in the past, medicine was very autocratic. You go to the doctor, they diagnose you, they write the prescription, they tell you, eat this, do that, exercise 3 times a day, and call me, take two tablets, and then call me if you have a problem, right? But once clients start thinking about the principle of co-creation, then the conversation changes, because when you co-create with a patient, it means that you are also empowering the patient. It's not an issue of you just telling the patient what to do. you may even coach the patient and ask them, how best do you think you will integrate this new treatment or this new plan or this new medication into your life, right? It takes all the coaching skills that we use, right? The listening, the empathy,
Yeah.
And there's such a huge benefit to that, because when you have an empowered patient, that is somebody that will actually be open in, with any concerns that they might have about their health. Because they've co-created, they're likely to be more motivated, about their health. They will have agency. They'll also be a partner with you as a doctor in their own health. So that is one of I'm sharing with you a conversation that I had with one of the doctors. I don't have data. I will get, maybe 3-4 years from now, I'll start collecting all my data to sort of show this in the healthcare space. But certainly this is the early feedback I'm getting from doctors. And of course, in other areas of healthcare, in nursing and other parts, it's clear that, working together and co-creating with your clients can definitely improve results. And what is very important is patient satisfaction, because you can be the very best doctor with all the credentials in the world and all the qualifications, but if the patient across you doesn't feel seen or heard or validated, they're going to leave that consulting room not really feeling satisfied, and then they will score you very low, that which is not very nice. So sort of having that and
Yeah.
having the patient, feel like they are part of their own health, can also improve the patient satisfaction. So I'm seeing a lot of benefits. So I was just giving you an example in terms of patient care. Of course, leadership is another area that I think lends itself very well, more around the collaborative leadership and making sure that you use everybody's skills. It's inclusive, and it allows people to really bring their best selves to the team. So those are sort of two examples that I can share with you around how Ubuntu might look in coaching.
Absolutely. I think that perspective is really inspirational for me at this moment, because I never thought coaching would be such a powerful tool. And now thinking it along the perspective that you've given about, and especially I love the fact about co-creation, right? And the example of within medical services that you co-create along with the patient, and which then kind of reflects or makes me think about, when we are coaching somebody, we are co-creating with them, right? We are standing by them, we are listening to them as people, and we are connecting to them at a much personal level. I would love to ask a couple of more questions about Ubuntu, but before we actually, I'll reveal something here now. Before we started the session, Bianca messaged me and categorically mentioned that she wants to lead the conversations about Ubuntu. So I'm just going to hand it over to her.
Okay.
I just
No
wanted to
problem.
make sure that we talk about it because in reading about you and reading interviews and listening to podcasts to prepare for today, I could feel that this is such a deep part of not only how you approach your service to the world, but just who you are and where you come from. And I feel like it's so important to honor that. I would love to stick with the 7 C's for a moment. So you mentioned co-creation, but I would love to hear if you have any other examples you'd like to share about any of the other C's, how you apply them in your coaching work, or how you see them benefiting healthcare.
Yeah. One of my favorite C's, of course, compassion. That's one that we use all the time in coaching and in healthcare. But one of my favorite C's is commitment to action. Right. I think it's well and good we can be compassionate. And I think for the most part, that certainly the doctors that I have worked with and healthcare workers that I've worked with, a lot of those qualities come very easily to them. But commitment to action, I think for most people can be a bit challenging, and trying to figure out what that actually looks like. My interpretation in many ways is commitment to action can be looked at as advocacy for your patients and for your team, for example, if you are a leader. I shared a story recently on one of my social media platforms, and a lot of people didn't believe me. They inboxed me and they said, "Are you serious? This really happened?" And I said, "This actually happened." And for me, it was a very rare example of commitment to action in leadership. I was offered the job of my dreams, wonderful job. And on the very first day of that job, I got a salary increase. On the very first day, day one, on the day when I met with my new manager. It sounds unbelievable, but this is a true story. And the background of that was that as the manager noted that although I had accepted the job, it was much more than I had gotten before, I still had undersold myself in terms of negotiating. And they said to me, "Listen, I think it would be unfair for you to accept this salary, and for me to know that we have budget for you to get a better salary that would be equitable to other managers on the same level." And so she advocated for me to get the salary that I should have gotten. I should have negotiated. Let me put it that way. But what was important out of that also was her recognition of possibly how that had happened. Because she said to me, "I'm not surprised that happened, because generally women under negotiate and Black people under negotiate." So when I saw this, I already sort of understood these dynamics that possibly influenced your acceptance of this salary. So that for me is a story about commitment to action. It was not just about, getting a new employee. I was seen as somebody that had overlooked and maybe underestimated my potential in terms of getting this salary. But she made sure that she went back to the establishment and everybody else that needed to be involved in ensuring that I got what I was supposed to get. And that for me is an embodiment of Ubuntu, and specifically the commitment to action. So it was not just crying about, we get low salaries and this is the behavior of, Black people, women don't negotiate. It was, I'm going to make sure that this changes. It will not happen under my watch, that there's a team member that is underpaid. So that's an example I can give around commitment to action.
That is a beautiful example. And I'm so glad that you connected it to the concept of advocacy, because I feel like when it comes to commitment, as you said, I think there is also some shared language that we have that can sometimes make people afraid to do it. Because what if it's the wrong thing, or what if it doesn't work out, or what if I feel stuck? But when you look at it through the lens of advocacy, it connects you back to your heart. When you advocate for something, you really are willing to do it because somehow, some way you feel like this is important to you. So I really love that connection, and I appreciate that so much. I would love to get into a little bit of like a storytelling moment if you're open. I'm really curious about the phrase that you mentioned, "I am because you are." And I know that this is like a big part of the philosophy. I'm just curious, like, what has that meant to you, like at different points in your life when you were a child, maybe, or how have you come to grow with that phrase throughout your life?
Yeah. One of the, I would say maybe the paradoxes of my life, and I talk about this I've talked about this a number of times. I grew up under apartheid, so meaning that I grew up in a very different environment as a Black person, as an African, to children of my age who were of different races. If you know a little bit about apartheid, you know that we had different systems. It was you had for Indians and Asians, for colored people, or what we call colored people who are mixed race, for white and for African. But my parents being educated people, they were able to put us in very good schools. And at that time, these were very different types of schools. They were called multiracial schools. So we started interacting with people of all races, although the Black children were the minority. And that is where I really understood that we were really all the same. We were all struggling with the same things, teenagers. You go through the same life, as young people, irrespective of the race, irrespective of the social background. If we were all being naughty, we were all being naughty in the same way, and we all had the same aspirations in life as well, in terms of, our academics and our aspirations and dreams about our careers going through school. So I kind of learned at a very early age, that there was so much that was similar, and what was different was much less. It was really about perhaps social constructs, really, but where you lived and money, worldly things. But at our core, we were all the same. So that's sort of one way that I kind of learned that lesson in retrospect, and I have carried that uh, as I evolved also as a doctor. And medicine has been a wonderful teacher for me, because you get to encounter people and you work with people from all walks of life. And one of my favorite places that I worked, that I felt I grew quite a lot in that regard as a human being, I really understood it, was I was a session doctor for a small clinic for people who injected drugs in the Johannesburg CBD. So for the most part, these were young people who were mainly homeless people, and everything else that comes with drug use and drug dependence. But I found myself really connecting with them, and what I learned, or what I was told when I started working in that clinic, was that it takes a lot of time for them to build trust. As a marginalized population, they are often ostracized. People don't respect, don't show the respect. They don't show Ubuntu towards them. The attitude of society general may be quite hostile and not centered in Ubuntu at all. And so it was the best advice. And I appreciate that I was given that heads up that you have to build trust. And so what that took for me is to go through the principles of Ubuntu, right? So, for example, co-creation, sitting with somebody who is struggling with addiction, and giving them the agency and saying, how do you think we can support you? How can I support you? Understanding their needs and letting them be part of the solution, was really a very beautiful thing to see my own growth in that, because I had to be very humble. I had to be compassionate. I had to understand their daily struggles as people who who had and who were struggling with addiction. So that was another part of my medical career that really helped me to see the importance of applying the Ubuntu principles if I really wanted to be the best doctor that I could be for my patients.
Nondumiso, it's quite inspirational on how Ubuntu as a philosophy has impacted the way you conduct yourself, either let it be in medical or in coaching, or I am also sure in the speaking assignments that you do. And I am now, I didn't realize, but we will be shortly running out of time. So I'm going to change the momentum of our discussion to a bit. What we're going to do now is we're going to do a rapid fire. So 5 questions
Okay.
I'm going to ask you. You need to say the first thing that comes to your mind. Are you ready? I'm putting you on the hot seat.
Okay. Yes, I'm ready.
All right. So, one word to describe coaching.
Life.
Okay. A book that changed your perspective.
7 Habits of Highly Effective People.
Stephen Covey.
Stephen Covey, that's it.
All right. Your favorite way to unwind after a long day.
Trash TV.
All right.
Amazing.
Coaching, speaking assignments, or medical profession. What's your preference?
Coaching, speaking assignments, or medical profession. Ooh, this is a tough one. I'll say coaching. Because you put me in a corner, but all of the above. But if
All
I
of
have
the
to
above.
choose, I'll put coaching.
All right. One thing people don't know about you.
I love cheesecake.
I'm with you.
Great. I didn't know that about you, though we've spoken so many times also.
Yes.
Okay. Bianca, I have a final question, but before that, do you have anything on your mind?
There's one last thing I'd love to ask. I'm very curious about like your present moment, the coaching that you do. I would love to hear about how you're seeing the Ubuntu principles actually making an impact on your clients.
Yeah. From the feedback that I get, I think there's a greater awareness of the other person. For the most part, I think, as we talked about, medicine has got has got its own culture, and people tend to be high achievers. People want to kind of show and demonstrate that they are good at what they do. They are competent. But it's the shift in mindset that they tell me about, as I've mentioned, is now really making sure that whether it's the patient, that person is feeling seen, they're feeling heard, they're part of the solution, they're part of the consultation, and equally so. And also with teams, just think about in everything that I do, how am I in service to the other person as a leader? So how can I support, as maybe an older leader, a young team member, who may be a Gen Z and I don't really know how to work with Gen Zs? What can I learn from them? And what can I teach them in return? So these are the examples I'm sharing with you that, people are sharing as saying, thinking about Ubuntu and having it top of mind is helping them look at the world and other people a little bit differently, and then inform their actions and their connection to other people.
Beautiful. Thank you for sharing that. I think awareness is such a powerful foundational skill to being able to navigate this human journey. So I love that your clients are receiving that from this holistic and grounded and cultural approach that you take. Thank you.
Right, Nondumiso. So I think we've gone from talking about your medical journey, the stress doctors go through, how you're helping them, the imposter syndrome, to incorporating the philosophy of Ubuntu in your coaching, your medical professional, your speaking assignments, and learning a few things about you also along the way. My last question to you for today is, if there was one thing that listeners should be taking away from our conversation today, what would you say that is?
You don't have to do it alone. You don't have to do this life alone. We are not designed as human beings to do it alone. Whether it is your colleagues, your family, and us here as coaches, right? And us here as coaches, we are really, that's what we do, to help each other, as we do through peer coaching, but also to help other people in service, so that we go through this life being connected. Me being what I am because you are, that's really the philosophy. So you definitely don't have to do this thing called life alone. That's what for me the main takeaway would be.
I think that's beautiful. I mean, you don't need to do this alone. And then reflecting back about everything we spoke about, the interconnectedness, I see you, I am because who you are. So I think it's beautiful. So thank you so much for joining us today in Nondumiso. I think this was a very enriching conversation, and a lot of our listeners are going to be benefited from learning from your learnings and your experiences. And Bianca, thank you so much also for joining us today and co-hosting this along with me. So, yeah.
Thank you. And thank you for having me.
Absolutely. It is our pleasure.
Absolutely. It was wonderful to hear about your journey and learn more about you today. And I do feel that people will be truly inspired by the underlying foundation that you stand on with everything that you do and that you bring to the table.
Thank you. Thank you, Bianca.